Thank you, sir. At the outset, let me thank Rajkot Ophthalmic Society, Suketu, Vatsab, Harshal, and everyone else for showing interest in this topic. Let me share my screen and start off. I think the screen must be visible now and I must be audible.
Yeah.
Yes, sir.
Right. Okay. Good evening again. On this Saturday evening, let us discuss a little bit about the tips to reduce the risk of COVID in our practice. We have been having a lot of webinars now and then, almost every weekend, lot of subject, and people have got a lot of subject knowledge. But I would say that the actual knowledge about the prevention and treatment for COVID is still controversial as well as a little bit underdone so far. So we thought we should discuss this for the benefit of Rajkot Ophthalmic Society. Why this statistics tells us actually. India today had about, or yesterday had about 49,000 cases on all-time high and 761 deaths. And also a lot of cases coming up in our surroundings every now and then now with regular frequency. So we need to know whatever we can so that we can take steps to prevent. The worrying part is, if you see this graph, it is the cases are still rising. The peak is not reached and the plateauing has not taken place. So we don't know when the graph is going to go down. So we have to be all the more careful. Now it is the turn of the medium-sized cities and the smaller cities and towns, I think. The bigger cities may have got their peak already, but at least we have not got it yet. And we have to be careful how to deal with it. One of the points everybody discusses is, can one person or one doctor, one hospital make that much of a difference? Any of us can get COVID from anywhere. And the course is unfortunately not very predictable, even in young patients or young doctors. And as doctors, we have higher risk for higher viral load. And obviously we are not alone. We have family, we have staff, we have patients around us, and we can contract the disease from anybody and also pass it on to anybody in our immediate vicinity. So we need to break the COVID chain, needless to say, and flatten the curve if and when the peak reaches, and need to protect everybody. If we protect ourselves, then we protect others also. So every person will make a huge difference if we take adequate care. The protocols and precautions have been given out already by All India Ophthalmic Society, IMA, government, etc. So we are not going to discuss in theory what are the possible protocols in every step. That is well known to us as doctors. We know that. The point of caution I would say here is, because so much has been drilled into us for last 3 or 4 months, that it has given a sense of familiarity, and familiarity breeds contempt, somebody rightly said. So that should not happen in coronavirus, because then we will all suffer. Nothing can actually eliminate the risk totally, but we have to try our best. There is no single magic formula or foolproof precautions, but we can try and reduce the risk as much as we can. That is why I'm going to show you a few pictures of what we are doing. Many other doctors are doing the same thing. So this will be just going back to the basics, reinforcing and reemphasizing some examples of what we can do. And if somebody is not doing it, maybe they can start. And if somebody has better ideas, we can share. There is a lot of gaps actually between what we know and what we practice about this COVID situation or coronavirus itself. So as Chekhov said, knowledge is of no value unless you put it into good practice. So we'll try to put into practice whatever we learn. Two main parts which I would like to talk about is, the first is the education and information for the public, patients and the staff, which plays a very big role, I feel. And then what are the changes we can adopt in our OPDs, OTs and patient management. So these will be the two parts. I believe that there is more risk for us from the OPD because we have more patients, more staff, and we spend more time dealing with the patients, dealing with the staff. And in retina OPD, it's all the more. So because we have more prolonged contact, we spend longer duration of time examining the patients. So naturally, there is more chances of things going wrong. So we need to take care right from the time when the patient steps into the hospital. Now, few pictorials. One is you should have a good information available for the public. Already there is a lot, but you have to customize it to your patients so that they understand and your immediate vicinity, so that the message is reinforced that this doctor is doing something, and definitely he will not allow us to be lax. So these are the 5 main pointers. Naturally, using a good mask, physical distancing, sanitizing, protecting senior citizens, and using ROS Setu app. Everybody knows about it, but it has to be reinforced every now and then. Yes, sir.
Mukesh, yes. Wonderful. The previous slide, wonderful.
Yes.
I'm not interrupting, no?
No, not at all. You are welcome to interrupt. This will be a very interactive discussion.
Okay. This is an excellent educative slide, and Suketu, why not under the banner of ROS or something like that, we would provide to all the ophthalmologists in Rajkot.
Yes, sir. We can make it for ROS. We can remove that central logo and put ROS logo.
Sorry,
yes,
not to.
No, that is fine. Obviously, everybody has to use it. That is the idea. And we'll definitely try to provide in whatever.
We can do it. Definitely, we can do it.
Right. In Gujarati. We have actually in Gujarati also. You're right. Somebody said.
I think I thought I've seen it somewhere.
Okay, yeah, I made it in Gujarati also. I am putting it up here in English for want of space and time.
Because, that is understandable.
Yeah, and that was for the general public actually. Now this is for the patients who come to the hospital. Now for the patients, we have to say that it is not going to be a routine visit. You are going to change a few things. Like they have to follow distancing. They cannot go close to each other and the staff. They have to carry their personal sanitizer bottle if they can. They have to install ROS Setu app before coming and update it in front of the staff in the hospital so that they are up to date and we know, we get a little bit of information about their background, and identity should be maintained because if someone turns positive, then there has to be contact tracing and all that, and decrease the number of attendants with the patients, all those things which we all know, but it has to be emphasized to the patient in good easy language. So we have put it up as banner, as well as we send it with through WhatsApp to the patients when they take the appointment in Gujarat. Now, for the public and the patient, we had something. Now, for the staff, actually, staff also has to know what is to be done, and they have to be repeatedly reminded. If they don't get reminded, they'll forget. And there is no way of checking all the staff whether they're following every particular aspect easily or properly or not. That's why you need some visual reminders pasted on the walls or on the desk so that they have a checklist to check what they need to do. And by rotation, the responsibility of the staff has to be to do 1 or 2 things in the list, and they have to know what they are responsible for. We have made a stamp also where the 5 important things of mask, whether the patient relatives are wearing a mask properly or not, ROS Setu app, the temperature check, the oxygen saturation SpO2 through a pulse oximeter, and consent, the corona consent. Whether these 5 are in order or not, we stamp it on the case paper, and when the patient comes to the consultant, then they know that they have been all checked. So we have a proper checklist maintained. Otherwise, we leave it to the others. They would have checked, or it just goes unchecked. Now the real part, I don't know how much value the temperature check has these days, because many patients can be afebrile and some patients can come with antipyretics. Okay, but you have to check the temperature of all the patients and all the relatives, because it has to send a message to the patients and relatives that it is important. And same thing, we have to have tons and tons of sanitizers. Liberally, you have to use for hand sanitizing no doubt, but also sanitizing surfaces and many other things which you constantly come in touch with. You have to set up barriers to keep the patients and relatives away from you, away from the reception desk. Otherwise, they lean over the reception and come very close to the staff, very close to the doctor. You have to take care that they have to maintain a distance. And it's a good idea to check the oxygen saturation, SpO2, of all patients and relatives when they are waiting in the waiting room. So sometimes if it is 95 or less, it can alert us to possible COVID infection. And also the Arogya Setu app, already I've mentioned about it. See, many patients have it installed on their phone but not updated, and many patients don't have it installed. Even just 2 days back, there was a young patient who actually refused to install it on his phone. Then we said, sorry, we cannot see you. So you have to be strict about it. If they have a compatible phone, you have to get it installed. And why it is important, while they are waiting for their turn to be seen, the app actually has a lot of information in local language. They can go through it and educate themselves if they have not already done so. The most important thing is the mask. Okay, many patients will have a N95 mask, but it will not be there properly placed over their nose, and it will be hanging down from their mouth. Then you have to make sure that it is put properly. And every time I tell them the mask is not proper, my staff actually got sick of it. Then they started cutting 2-inch size tapes and put on the nose of every patient, 50% on the mask, 50% on the nose. So now it is a rule that all patients and relatives coming into the hospital will have a tape fixed on their nose bridge to keep the mask in place. Whether it is sliding down or not, it's a good idea, I feel. So it automatically prevents the mask from going out of its place. And you have to have a lot of posters announcing or requesting them to wear the mask properly. And we have made it a rule that any staff who is caught with the mask like this will be asked to pay a fine or we deduct a nominal amount from the salary. And any staff who takes a photograph of any other staff like this will get rewarded with that nominal amount deducted from the other person's salary. And they make a game out of it and stay as careful as possible. This is how the staff and doctors have to be protected. It actually may look very excessive to many doctors, that what is the need for all this when the contamination is going to occur from the nose and mouth and hands. So if you protect that, it is fine. But I think a 2-layer clothing, it need not be a full PPE with adequate gloves and face cover or face shield is essential so that you can work for a prolonged period of time. If you need to spend longer time with the patient, you can spend accordingly. And you have to keep sanitizing in between. You can have rotation of the staff to supervise various duties, like the Arogya Setu app, whether the masks are proper or not, whether the sanitization is being done properly or not, whether gloves are worn properly, whether the gown, this is all OT gowns were worn by the staff, and PPE kit worn by the surgeons, and face shields worn by the reception staff, and a lot of sanitizer at hand, which is sprayed to every patient, every relative, and every doctor every few minutes, every 5 minutes or so. And some of the patients come with young relatives who are bored of waiting. We can involve them actually. I particularly use the school kids. If they are accompanying the patient, then I tell them that you have to supervise this particular thing with all the relatives and patients. And if you do it well, we'll make your consultation free. So they learn something. They are also involved in active monitoring of others, relatives and patients, which sometimes is not possible by the staff alone. Now coming to the doctor's protection. Now this is the basic thing. You have to wear loose fitting, comfortable clothes. For me, it is the OT scrub dress, gloves, N95 mask, cap if you want, socks with foot cover, and easily washable shoes or footwear. Now, this is the bare minimum, I feel, and with a bottle of sanitizer in the pocket always. You don't have to rely on the staff. Now, this is how you actually enter the hospital. And as soon as you are in the hospital, you either wear a PPE kit or wear a surgical gown on top of that, so that you don't have to change from whatever you have been wearing into a hospital dress. Otherwise, if you wear the regular clothes, you have to change to something in the hospital and then change back when you go back. Actually, much of the contamination occurs when you change from one dress to other. If you have a second layer of clothing, you can just discard it safely and inside in an inside out way. There is a technique to do it, that the outer part should not touch, and you have to fold the gown or the PPE in such a way that the inner part is coming out when you take it out. Now, one more thing I can say is there is this tower fan behind the consultant. This blows the air away from the doctor towards the patient, and any air conditioning or any fan which blows air from the patient towards the doctor should be avoided. The ventilation should be away from the doctor, so that any virus particles which are coming towards the doctor are or towards the staff are dispersed away. And preferably the air conditioner should be off, the doors should be open, ventilation should be the maximum, so that all the airflow or air changes are maximum every few minutes at least. When the PPE kit is not available, we used to use the surgical gown for protection. This is the HIV kit actually, and this is a full PPE kit where there is a head cover, there is a N95 mask with a 3-ply mask on top of it, there are eye goggles, there are gloves, and foot cover also. So literally no part exposed. All of this may not be necessary, but what it does is it allows you to see patients for a longer time. You can do a complete examination. You can have less fear of getting infected if you spend more time with the patient. And all your examination equipment should have some protection or shields, barriers. This slit lamp actually has one big breath shield and one smaller one also, so that there is 2 layers of protection from this slit lamp while examining the patient. The patient also has to wear the mask properly. And the indirect ophthalmoscope also can be easily fitted with a barrier, plastic sheet or any barrier will do. Even if it is sometimes opaque, it is okay. There should be a barrier between the breath of the patient and the doctor who is examining. So you can use any such thing to put it in between the slit lamp, between the patient and the doctor, as well as the indirect ophthalmoscope or any instrument you are using.
Mukesh, one question.
Yes, please.
You are wearing double mask?
Yes. Here you can see.
Regarding that?
Sorry?
Please clarify regarding that.
Yeah. Okay. I was going to come later, but I'll clarify now. See,
Okay.
I always wear a N95 mask, and on top of that a surgical 3-ply mask. And these masks have the strings which are tied at the back of the head, not at the back of the ear. If you wear a mask which have the strings going to the back of the ear, after some time it becomes uncomfortable. Then you don't want to wear it for long. You want to take it away. And here, sometimes the N95 mask does not fit so well. Most of the time it does. But if you cover it with a nice tight 3-ply mask, then it keeps it in place, and also it gives that additional layer of protection. I believe that if you use the double mask like this, N95 plus a good 3-ply mask, then it becomes N100 almost, or N99, not just N95. And also it keeps the N95 mask relatively clean. So you can use it for a longer time. Harshal, does that answer the question? Yeah, I think it's not. Anyway, now the next point is.
Yes, it does. Okay, I'm here. I just muted it so that you are not disturbed. Just one moment. I
Yeah.
request the participant to switch off their mics because sometimes the background noise is disturbing the talk. Thank you.
Right.
Okay, Mukesh, please continue.
Yes. The next point is using the UVC to disinfect objects and something like currency, paper, mobile phones. It is now well proven that UVC 254 nanometer or a 222 nanometer is very effective to disinfect or to actually kill the virus in a few seconds. So what we have done is made UVC towers with UV tube lights fixed onto an IV stand like this, and they can be used in any room for any amount of time as per our requirement. These are mobile UVC towers. And at the reception, I've also made a UVC cabinet where the case papers, the consent forms or whatever paperwork the staff is doing can be put inside that and sort of disinfected within a few minutes. And you can design boxes with UV tube lights to whatever size you need. This is an Ozudex box which doubles up as a UVC box with a small UV tube light inside it. This is very useful for keys, cash, and things like that, small objects. Now, that is for the OPD and the circulating relatives and patients. Preoperative patients, do we do anything additional to the routine? It will be a good idea to get a CRP done with all their pre-op investigation. Normally, the pre-op investigation does not include CRP, but you can order for that along with the blood sample, and it can be done easily. When there is a suspicion or when you have some time or when you want to be extra cautious, you can order a HRCT to be done for some selected patients if you suspect that they need further testing. The role of COVID testing is controversial. It's not easy to get it done. The report does not come fast, and you need to wait. There are certain protocols associated with it. So we don't generally do COVID tests, but if somebody can do it for all their pre-op patients, it's well and good, but it is difficult. The easy thing to do is all the patients who have to come into the OT will need a fresh N95 mask or at least a very good quality surgical mask before they enter the OT, and that has to be kept on during their surgery and preferably well taped to the patient's nose so that it doesn't slide off. I'll show more about that later. This is what we do inside the OT on the table. The patient's cloth mask is there. He has a new fresh 3-ply mask on top, and then we put this flexible venti mask. It is modified in such a way that it allows the major part of the expired air to go out through a tube into a sodium hypochlorite solution. The nasal cannula, which we use for oxygen supply in any surgery routinely, is always there under this mask. So the patient gets a steady flow of oxygen for inspiration, and the expired air, actually this is modified. I have a piece here. If you can see, this goes like this. Normally this is to supply the oxygen. What we do here is we then use it to take out the expired air where the holes meant for expiration are closed up, and we give oxygen through another tube which goes under this mask. So this sort of reduces the contamination from patients' exhaled air in the OT and makes us a little bit more confident of spending longer time in the OT. there is a video to show the tube, but it is not probably running here, so I'll skip it right now. And for those who are interested, I can show how it is to be. It's very simple. It looks complicated here in the picture, but it is quite simple and it can be quite useful, I believe. The idea for this was given by Dr. Twinkle Shah in Ahmedabad, and I adopted it quickly and use it in all my patients needing surgery. We made retina surgery a true daycare surgery. That is, if the patient needs surgery, is admitted, operated, discharged the same day. Usually we try to avoid post-op follow-up on the next day. Normally we do it the next day, but in this situation, unless it calls for specifically, we give instructions to the patient what to do, what not to, and send him home on the same day so that the patient need not crowd the hospital on the next day also. And what is important is to have a dedicated hospital WhatsApp number. Why? Because sometimes you need to send a prescription. Somebody, some patients would want to send their photograph of the eye if there is some redness, some swelling. So one of your staff should be, or some of your staff should be well trained in sending and receiving photographs and prescriptions. They can ask you for what is to be sent and what is to be done. But if you give your own number, then you are in for trouble. They'll constantly disturb you. That is not recommended. But you can dedicate a few staff to do that with a specific number. That helps. Another thing I found useful was you can counsel the patients at great length, not face to face, but from another room, on the intercom, on the phone. You can see here that the staff is in one room and the patient and his relative is in other room, and they can, once the consultation is over and if something has to be discussed in detail, then you can use the teleconsultation after the actual consultation. Because nowadays what we do is we tend to dispose of patients in a hurry, and sometimes they are not satisfied. To avoid the dissatisfaction, you can give time to the patient, but not face to face, from another room on the phone. You can also see that the windows here are open with the AC off, so that the full ventilation is there all in all parts of the hospital as much as possible. Yeah, these are the various PPE kits which we have used over the last 3 or 4 months. The two funny pictures I thought I'll pick out. One is my fellow receiving the certificate, and at that time also we had full PPE kit, and the older PPE kits were a little bit cumbersome, looking like space astronauts, but we used them. But now better PPE kits are available, which are lightweight, comfortable, washable, and even autoclavable if you want. And they cover from head to toe. They have a foot cover, they have a head cover, they have a full body cover. And last 2 weeks, I've been using this portable speaker with a microphone, because with all this and with the patient sitting a little bit away, maybe 5 or 6 feet, it's sometimes difficult to hear what you speak. So you can speak into the mic, this amplifies it, and they can hear you loud and clear. It still doesn't solve the problem of hearing the patient well. I still can't hear the patient very well because he doesn't have the mic, but this is at least halfway the solution is there, that you can adopt and spend some more time with the patient at a distance. Otherwise you need to go close to the patient. You automatically tend to go close to the patient when you can't hear the patient properly, or the patient cannot hear you properly, he comes close to you. So in summary, you cannot eliminate the risk of COVID entirely, but we can try by following the simple precautions repeatedly. The main thing is your staff, actually. If they understand that you are serious about it and you want them to follow a particular protocol, come what may, then they try to cooperate. You have to make it interesting for the staff. If the staff comes up with a new tip, actually this mic idea was from one of my senior staff. He said, why don't you use a mic to make the patient listen to you better? So we adopted it, we rewarded him also. So every new tip which the staff gives for making our protection better, they get some monetary incentive also. 3 things we have to do, all of us. There is no way out of this, especially with the cases rising now in Rajkot also. Wear an N95 mask, please. Many people say that N95 mask is not necessary in the OPD. A 3-ply mask is enough. I don't believe it, and I would strongly advise that you don't just get away with a ordinary mask. Where see, normal mask which is not N95 actually protects the other person, not yourself, if you are wearing it. An N95 mask protects yourself and the other person, both. So it is better to wear an N95. I make it N99 or N100 by wearing a surgical mask on top of the N95 also. Wear gloves. That actually prevents you from touching all surfaces, your face constantly. If you don't wear gloves, reflexly you do that. And other advantage of wearing gloves is you can sanitize your hands as much as you want with any chemical you want. You don't get allergies, you don't have skin irritation. You can dispose the gloves when you want, and you can keep sanitizing them if you need to. So this is very important. Another
one thing.
Yeah.
One thing, Mukesh, regarding the mask, there are those ones with respirators available.
Yes, I was coming to that. Yeah. See, it has to be mask without valves. See, there are N95 masks with a valve. They call it respirators. And also there are certain 3M respirators available where you have additional cartridges which need to be changed after a particular amount of time. They are not recommended actually. The respirators are no good for other people. The N95 mask with respirator makes it easier for the person wearing it, but it also sprays the virus if the patient is infected. So they're not to be used. And same thing with the cartridges which are there with the big looking masks, like 3M having 2 cartridges, those pink cartridges on the sides which need to be changed every few days. That I won't recommend because they are industrial masks. They are for particles. They are for metal fumes. They are not for bacteria and viruses. So, so much about the mask. Another thing, now that we are at mask, use the mask preferably with the thread tied around the head at the back. As I told you before, if it goes on your back of the ear, you will soon get tired of it. So the mask I wear, both the N95 and the 3-ply, have long strings which you can tie at the back of the head, and they can last 4 hours, 5 hours till you need to wear them for any amount of time. Another small tip is, when you have an N95 or a 3-ply mask, test the quality by cutting it and seeing the inside. An N95 should have 5 layers. Sometimes you get just 2 or 3 layers and it is a spurious N95. It won't work. And 3-ply mask, I've had a good company coming to me and telling me this is 3-ply mask for surgical use. But when I cut it and saw, it is only 2-ply. It is not 3-ply. So it has to be confirmed as much as possible. Now coming to what you can do for your staff. There is recently launched COVID insurance, Corona Kavach policies, etc., which cover for COVID after 15 days. It's a good idea to gift each of your staff one such policy. They will make them happy. Not that you want them to use it, but at least there is a backup in case anything is needed. And I tell them that more than the insurance policy, the masks are the insurance. So all the staff also are encouraged to use N95 masks. We actually provide them with a set of 3 or 4 which they use by rotation after disinfecting them in the UV chamber. Our hospital has UV cabinet, so they are instructed to put their used N95 mask named, labeled properly, and disinfected, and then they can reuse for some amount of time. We all know this picture, the statistics of transmission between two people wearing masks is minimum. We cannot have too much distancing in our hospital, unfortunately, because we have all of us have limited space with the patients and relatives all at the same time. You cannot have 6 feet distance. Now somebody says it is 10 feet needed. Somebody says it's 6 feet. But at least if everybody wears a mask, the risk can be minimized. This is what we are targeting. Risk less than 1.5%. As they say, prevention is always better than cure. More so for this situation, because not only COVID has health issues, that itself is a big problem. It has a lot of protocol issues. That is, once somebody tests positive, there has to be a lot of contact tracing, the family tracing, quarantining, and the government will make you do so many things. And that is very uncomfortable. You'll have to shut down various things and lose a lot of time. And it is very taxing. And you won't believe me, today actually I had to call up many hospitals for 3 patients coming from outside Rajkot, from the periphery, were positive for corona. They could not get beds in the hospitals, any hospital, till the evening. This is the situation, and that will apply to our staff, ourselves also, God forbid, if the need arises. So to avoid all this, the protection is more and more necessary. Sometimes it may appear to be excessive, but it is better to be overcautious than undercautious. And the bottom line is, mask is everything. Make sure that your staff, your family, everyone around you understands that, and we need to educate everybody and also follow it. So this is my points about what we need to follow. Of course, there will be a lot more discussion to do with these. Queries are welcome. Thank you, and be secure, be safe, protect yourself well.